I've had some patients being confused about the messages that the specialists or the cardiologists are giving them about lifestyle change. Lifestyle change comes in the form of thinking, eating, activity. The anti-inflammatory lifestyle, which really embraces a new way of relaxation therapy, which we're all lacking as Americans, unless you're a meditator or a yoga practitioner or Tai Chi practitioner. A new way of nutrition concepts to follow, and a new way of concepts for, or understanding concepts for exercise or movement. It doesn't even have to be exercise. I hate to drop that in anybody's plate because it's like, oh, there's a lot of activity I gotta do. But it can be in the form of walking or hiking, which is the most basic and easy and cheapest thing you can find out there available, as long as you have a coat and a pair of shoes. So the idea is to make changes. Whether you're on cholesterol medicines, whether you've had a heart attack, whether you've had stents, whether you're having chest pain and haven't been worked up yet, or just plain old overweight, the idea is to make the lifestyle changes that will help you lower weight. With that, hopefully lose the cholesterol medicine or lower the cholesterol as well, in addition to blood pressure, in addition to better sleeping, in addition to sleep apnea. All those things cascade when you make the lifestyle change and you commit to that lifestyle change for life. Now, everyone needs a personal way or a personal path that has to be mapped out for them. There is not just one blueprint of eat this and you'll get better. When my patients fail to keep up the lifestyle change, it's usually because they follow a single book or a single novelist, an author. And that is possible, but it really has to resonate with you, and you have to read the entire book. Chris Gardner, a scientist out of California, had followed people who went on 4 different diets, very popular diets, and by the end of 12 months, most of those people gained the weight back and more after they finished their 12-month attempt. And he also found that the majority of them did not read the entire book. So if you go cover to cover and understand all the concepts, you might have a better chance at that sustainable change for the rest of your life. But it really, again, the blueprint is not in the novel or the book. The blueprint has to be created. Whether you pick and choose different bullet points from all the authors or you create your own lifestyle change, it has to resonate with you. And then it has to be a mixture of those 3 components that I mentioned. Not everybody likes, or not everybody can sit down and meditate. Not everybody can walk or hike. Inner city is challenging. If you're wheelchair bound, same thing. If you have degenerative arthritis, you might have to pick swimming, and then you have to have a place to swim. So there's always different challenges, and that's why I think a physician is supposed to be on your side and help you create things that will make the life changes sustainable. With regards to cholesterol, if you do make those lifestyle changes, there's no guarantee that your cholesterol and your blood pressure will drop in the first year of your change. Sometimes it takes decades. Hopefully fast, you'll probably see a lot of weight loss, but sometimes the blood test will come later. I mean, the improvement in your blood test will come later. And that's also dependent on what other medical problems you have. In general, you lose the weight significantly and you get to lose your cholesterol numbers, your cholesterol medicine, and your blood pressure will drop. There is some validity to a cardiologist when he says it's in your genes. I don't like that statement, it's in your genes. It almost says that you're going to be stuck with this, so don't even bother with lifestyle change, just take the medicines. But by that same token, if you take the medicines, that's not a guarantee you won't continue on with disease. I think medicines or no medicines, you really shouldn't make a lifestyle change. And if your lifestyle change is good enough or aggressive enough, successful enough, then you should be able to get off of the medicines, unless you have something called familial hypercholesterolemia. FH is a disease entity where you do have this inherited possibility of sustaining damage over the long run to the lining of the blood vessels, specifically the blood vessels of the heart, the coronary arteries. The lining of every blood vessel is made up of something called an endothelium. These are one cell layer thick membranes that also secrete hormones, but by the same token they also get damaged. They get damaged if you have hypertension, and they get blasted or stretched open with every hypertensive heartbeat. Then that could be only with stress, like if you're driving along and somebody cuts you off, or if you're behind schedule. I refer to my truck drivers because most of them say, I'm not stressed out. But to be on an average American highway and not be stressed out, that takes a lot of practice. So I will usually remind them that they're in a stressful environment. Their reaction to the event in that environment is what usually causes the fight or flight response in most people. It might not be like you're going to die, but it still will bring up some hormonal changes to protect you. And those hormonal changes sometimes will make the blood pressure just for a short time higher. With enough blood pressure on the endothelium, that delicate one-celled lining, it can damage and tear. If it tears, it should be able to repair. That's if you don't smoke and you have your lower cholesterol. People who have high levels of cholesterol, especially the bad one called LDL, when there's enough LDL around and there's enough oxidative stress around in the body, tobacco, processed foods, high omega-6 foods, alcohol, other toxins, when there is a high enough amount of oxidative stress, the LDL will actually become oxidated, and that becomes painfully, that's an inflammatory product. When that inflammatory product is floating around in the bloodstream, it will eventually float around and touch upon that small tear in the lining of one of the arteries. Once that small tear accumulates that sticky oxidated LDL, more LDL attaches, and then it becomes a big inflammation in that area. It's a pro-inflammatory. It's like a nidus, like a small snowflake that accumulates more and more snow. So that over the course of time you'll have platelets attracted to stop this clot and fix it. You'll have more fibrinogen, you'll have more cholesterol plaques, and you'll just get to the point where it just obstructs the whole lumen, or the center part of the blood vessel, and that's a heart attack. It ends up in catastrophic death, and you might not know about it. So that's why if you're high risk, if you have a history in the family of heart disease, if you have a history in the family of familial hypercholesterolemia, and I'll put a link to one of the organizations online so you can learn about it. If you smoke, if you're overweight, if you're high stress, then you have the chance of a sudden catastrophic heart attack. And it doesn't have to manifest itself as chest pain a little bit in the beginning and a lot at the end. It can be very atypical. A lot of women in the United States don't recognize their symptoms, and the first symptom they have, in 50% of the women that have heart attacks, the first symptom is sudden death. It's not a good symptom to have. So that's why it's so important to go to the right doctor who's going to listen to you and figure out what your risk factors are and how to look into those possibilities of damage. And then once you have a diagnosed problem, move away from it or fix it. Now, you don't have to go for a cardiac catheter. Everybody doesn't go for a cardiac catheterization to figure out if they have clean vessels in the heart or not. That's a dangerous procedure, by the way. There is some risk with it. That's why we save it. We'll do stress tests, stress echoes, nuclear stress tests to kind of figure out things. Even before then, we'll do not only fasting lipid profiles or cholesterols, we'll do fractionated lipid profiles. We'll do high sensitivity CRPs, homocysteine levels. All those things all add to build a case to see if you're really high risk or not. And then if you are, then you go for the big test, if you get approved by your insurance company. So I think the cardiologists that I use, number one, they have to be listening to what my patients, why I'm sending my patient, and what my patients have to say. but they also have to be helpful. I think an integrative cardiologist is always better. To go to a cardiologist that is just surgically oriented, you'll probably have surgery. To go to a cardiologist that likes to work with a lipid clinic or is very well versed in familial hypercholesterolemia, I think they're a little better. And remember, sometimes when you have FH, you don't go by the normal standards of what cholesterol is supposed to be. You have to be driven very, very low levels. So that's why it's sometimes important to go to a lipidologist, or at least a cardiologist that specializes in FH, or a lipid clinic. They might have a lipid clinic in their clinic, but it's nice to seek these folks out if you're high risk. If you're not high risk, then it's not going to be in your genes. But still, a lifestyle change has to stick. I'm not saying that you have to be on an all plant food based diet, but a mostly plant-based whole food diet is healthier for you, just like my cancer patients, just like my obese patients, just like my diabetic patients. That's the objective. To get you there would probably take some teaching. Not everybody likes to give up meat, but I think portion control is very important. Not everybody likes to stick 9 fruits and vegetables in their diet, but you have to wedge that into your diet. I guess redistribute. Instead of 2 big meals, you redistribute your diet over the course of the whole day, spread it out, and don't necessarily add more volume, but just kind of portion control, so that your pancreas will tolerate it better and you won't be so high in your insulin secretion. If you eat a big meal, you usually, and you wait till you're starving, the stomach secretes this stuff called ghrelin, and when your stomach is full, the ghrelin is supposed to stop, and that gives the brain satiety. There's other hormones too, but if you wait till you're starving, the ghrelin, even if the stretch receptors in the stomach are not secreting it anymore, your brain will still go to find more and more food. That's why it's hard to stop eating when you get home late at night, or when you wait till the last minute to have something. If you wait till you're very hungry to eat, like my college students, the likelihood is you're going to be starving and famished by the time you prepare food, so you're not going to prepare it. You're going to go for something that's pre-made. And that's, again, that cycle of processed foods. So you might be bulletproof when you're in college, but the damage accumulates. So again, this is very important to understand the concept of what happens with cholesterol. Usually with a mostly plant-based diet, you'll have lower foods that have cholesterol, and you'll have higher fiber. You'll be better with your omega-3s, and you'll have less omega-6. So everything cascades, and you'll actually feel better. You'll feel more satiated. You'll have less of the jitters after hunting for food, instead of just eating peacefully and more regularly with the right amount of foods. You'll get better sleep, you'll have better exercise recovery, everything works better. Your thinking, your problem solving, everything will work better. But the objective is to get there and to be able to sustain that form of nutrition change. That needs help. So seek out either myself or a registered dietitian, somebody who's very well versed with nutrition, and you should be on your way. And if it doesn't work the first time, then you reformulate and see what failed and do it again. But you don't go back to the same book that you used 3 years ago and expect the lasting changes.